Attitudes and treatment of people considered mentally ill has changed drastically over the last 100 years. In the USA, a major contributor to this was the Community Mental Health Act of 1963, signed into law by President John F. Kennedy. To discuss the legacy of the act and where we are today, I'm absolutely delighted now to be joined by President Kennedy's nephew, former Congressman Patrick J. Kennedy. Patrick, thanks ever so much for joining us today.
It's great to be with you.
Tell us a little bit about the Act of 1963, how it came about and what its legacy has been.
Well, my aunt Rosemary, who was the closest in age to President Kennedy, had not only an intellectual disability, she had a bipolar, I think you would call it today. That led her to get the evidence-based treatment at the time, which was a lobotomy. But the whole event so basically traumatized my whole family, but especially President Kennedy. And when he went into the Senate, and then when he obviously took over the White House, he proposed a system of care that was community-based that applied for both those with mental illness and those with intellectual disabilities. But unfortunately, when the Congress ultimately tried to enact it, Congress could only agree on covering people with intellectual disabilities because, of course, the feeling back then is that people with mental illness brought it on themselves. We have been able to, over the years, and now we have a parity rule that's right in front of this country with the Biden administration. The best chance to hold insurance companies accountable insofar as how they treat mental illness commensurate with how they treat other chronic illnesses. So I implore the psychiatric community to really weigh in right now in Washington to get the Biden administration to issue this rule as soon as possible. And if they do that, it will help us advance equity in mental health coverage for this country.
One of the things we've been talking about a lot this week is addiction. And how important do you think the community health approach to addiction is?
Well, I think the community approach, whether you look for mental illness with the Fountain House here in New York, all the clubhouse models are perhaps the most evidence-based interventions, and yet they're not paid for by insurance. We only reimburse for intensive rehabilitation, and that frankly is not enough. We need to build community support so people can reintegrate into the community, get supportive employment, and, as I said, supportive housing.
How difficult and important is it in the United States to have a national mental health approach?
Well, I'm just released a book called Profiles in Mental Health Courage, hearkening back to John F. Kennedy's Profiles in Courage, which highlighted political courage. I think we need courage in people's telling the true story of what it's like to live with these illnesses. In the back of this book, I have a national agenda to how we solve our country's mental health and addiction problems. Housing, criminal justice, human services, CMS, all of these things need to be integrated, but unfortunately, because the budgets are so siloed, we rarely integrate all of the funding to get the best outcomes. So we really need to, frankly, right now, is our moment to finally develop a mental health system, not mental health services per se, but a system. And we need the American Psychiatric Association to really step up right now. We cannot wait. This is a formative moment in our history.
Thanks ever so much indeed for joining us today. It's been a great pleasure.
Thank you for having me.